Welcome to the Nationwide Connected Care demonstration. Our presentation today is not just a demo. These are services and connectivity that are live on our network nationally at scale. We were formed 9 years ago as the first industry-led alliance focused on nationwide data exchange and have grown remarkably since. CommonWell is a not-for-profit trade association open to those who share our same vision that health data should be available to providers and patients regardless of where their past care has occurred, and also that the technology be built into the health IT solutions. We're proud to have members that span across more than 20 care settings with over 80 members, and about a third of those, as you can see on the left-hand side of the screen, are service adopters connecting to the network or soon-to-be service adopters. 6 of our members are here today showcasing CommonWell services across 6 different venues of care in 2 states, all working together to improve outcomes through nationwide connected care. Today you're going to be following the journey of Oscar Garcia, a 36-year-old active, historically healthy man who lives in upstate New York when not traveling as a travel nurse. He's soon going to be one of the 125 million people in the United States managing a chronic health condition. In the span of about 25 minutes, we will cover his journey, covering 12 months, meeting with caregivers, and traveling over 1,000 miles. During this demonstration, we will be highlighting CommonWell services, including patient ID and linking, our record locator service, data broker, ADT notifications, all done within our Trust network. While you're listening, we want to make sure that you are keying into some of our services that our members will be highlighting. First, auto-linking, or the ability to seamlessly match patients across care settings. ADT notifications via our event notification service, or also called ENS. Fire document and fire discrete resource data exchange. Trusted dynamic client registration, and technology built into all of the software. All of this to ensure that the care is centered around the person, ultimately allowing them to live their life and worry less about managing their own care. So let's meet Oscar and watch his care transition through 6 vendors and care settings, all connected by the CommonWell network. I will now transition to Athena Health.
Good morning, I'm Kirkley Cheney. I'm with Athena Health, and today I'll be representing Oscar's primary care physician. So Oscar presents today for his annual PCP visit in Buffalo, as you can see here on the screen. Oscar has not been to his PCP since 2017 because he's a traveling nurse. In 2017, Oscar was enrolled in the CommonWell network, which means that his records are being shared across the network so his provider can see any care he's received in the past, as well as track his future visits. Athena is able to query CommonWell at 2 a.m. on the morning of his appointment, so any documents are available in this Find tab here, and the provider is able to review these before Oscar enters the exam room. So if I click on this Find tab and then come under Clinical Document, Record of Care, the provider is able to review any other episodes of care that Oscar has had. For example, this document here from 2012 shows that Oscar was hospitalized, and this document here is from Cerner. Oscar presents today with early MS-like symptoms. He has muscle weakness and fatigue, so the provider orders a CT scan for his head, a CBC with differential, and a chem panel. All of the results come back normal and don't indicate that Oscar had a stroke. The provider also refers Oscar to a neurologist. Now I'll pass it off to eClinicalWorks to talk through Oscar's neurology appointment.
Hey, good morning, everyone. My name is Siddharth, and I am representing Dr. Sam Willis today, who is the neurologist for our patient, Oscar. So I'm going to start with Oscar's record in ECW. So right at the top, you see that how Oscar's records are maintained in eClinicalWorks. And right below on the screen, on the second half, you see their record in the CommonWell network and also the different network links where Oscar has visited in the past. All the yes on these columns depict that the patient has confirmed that they have visited these facilities in the past, and this will also allow our system to query the CommonWell network to access the information in advance. Next thing which I'm going to show you is how Dr. Sam Willis has decided to do some pre-visit planning. And in order to do so, they have scheduled ECW system to run a query 2 days prior to the patient's appointment. Once these queries are run, the information coming from the Commonwealth network can be seen on the interactive clinical wizard. So on this screen right over here, you can see different problem lists, allergies, medications, and the different histories that have come over from the query that was run 2 days prior to the appointment. The provider also has access to quickly import any of these in today's visit by simply clicking on the arrow right over here. They can also click on the paperclip to see the different documents in details. So the next document which I'm going to show you right now is the PCP's note which came over from Athena Health, and you can see all the details which came over from the PCP's visit. You can also see the results of the CT scan that was held during the PCP's visit, and this will definitely help a lot of repetitive work, and the neurologist will not have to do this over and over again. All right, so going back to today's visit, the patient is checked in and the provider discusses the underlying issues with the patient, and depending on the discussion, Dr. Sam Willis has diagnosed the patient with multiple sclerosis. And for this, the treatment plan includes 3 different medications, which you can see on your screen right now. The provider also wants Oscar to take a MRI brain with contrast. And towards the conclusion of the visit, Dr. Sam Willis would like to see the patient in a 2-month follow-up visit. So this basically concludes the appointment in ECW, but the patient was really pleased to see how the information exchange was really seamless, and it really helped a lot to eliminate a lot of repetitive steps. I'm going to pass it on to Cerner now. Thank you.
Good morning, I'm Travis with Cerner. I will be representing Oscar's hospital admission stay today. Later in the year, Oscar develops a severe respiratory infection caused partially by his MS immunocompromising medication. Due to having MS and the acuteness of his breathing problems, Oscar is admitted to the local hospital. Upon registration, Oscar's patient demographics are sent to the Commonwealth Master Patient Index, and because his provider uses auto-linking, there is no manual intervention to link Oscar to his past care locations. Auto-linking is a Commonwealth service that automatically links patients to the care setting using an exact deterministic match on demographics such as first name, last name, address, sex, age, and other demographics. Here you will see the Commonwealth locations that have pulled in through auto-linking. During the admission, an ADT notification is sent from Cerner's Power Chart solution via the Commonwealth Event Notification Service that notifies subscribed providers on the network about events that occurred for the shared patient. The medical team then queries Commonwealth for Oscar's patient data, and they receive Oscar's information from their PCP and neurologist. Based on the data they receive, providers can reconcile the problems, allergies, medications, and other data. Here you can see Cerner's seamless exchange solution that displays the outside record data side by side with the local record data. Providers also have the ability to set up trusted sources with seamless exchange that allow this discrete data to directly write to the patient's chart to avoid manual intervention. When Oscar is ready to be discharged to home health, his provider sends a referral via direct secure messaging to the MatrixCare home health system.
Good morning. My name is Carrie Schmidt. I am representing the Home Health and Hospice Agency, MatrixCare. Cerner has sent an e-referral over into MatrixCare for Oscar for skilled nursing services and physical therapy. The e-referral has come over in the format of a CCD using direct secure messaging. You can see here that we have his addresses auto-populating and matching using the auto-linking services that link to his past care locations. In addition, the CCD MatrixCare can consume a lot of this information, which will auto-populate into his referral tabs. Now, using HL7 Fire to query and receive his clinical documents, MatrixCare automatically accesses data. specifically those that are from his PCP and previous neurology visits. So what you are seeing here is the summary view. On the left-hand side, you will see the different links for the previous healthcare systems that Oscar has received services at. The home health agency is able to review clinical documents down below and choose a select number to save into the patient medical record. Once they do this and it's saved into the chart, the agency is able to consume portions of the data directly from the note itself. So as I mentioned, if I tap on the Baseline West Medical Center location where he's had many of his visits, over on the right you can see the different document types. And here we have our progress and episode notes. There's 7 of them. If I go ahead and tap on that, we are actually able to consume diagnoses, allergies, and medications directly from the documents. Subscribed CommonWell providers now have access to these visit notes as well as patient information. When Oscar was admitted to the home health agency, an admit notification was sent to all his subscribed CommonWell providers that have been involved in his care. After 3 weeks on home health services, Oscar has been discharged prior to Thanksgiving. Upon discharge, there's also a discharge notification that is sent to all of his subscribed CommonWell providers that have been providing him care. At this point, I'm going to pass it over to Meditek to continue Oscar's journey.
Good morning. My name is Joe Wall from Meditek, and we'll be playing the role of the emergency department. So Oscar is on assignment in Baton Rouge. He's experiencing some symptoms, fever, shortness of breath. He gets admitted to the Meditek emergency department on Expanse, in which point we are going to register Oscar, capture critical patient demographic information, which is going to allow us to do the auto-linking that you just heard of on the past visits. And what we're also going to do upon admission is we're going to use CommonWell. We're automatically going to send a ADT transaction to their previous care providers, such as the neurologist, using CommonWell's event notification service. So we'll see that later on down the line. So we're going to use CommonWell's record locator service to gain records and access the information such as the documents that are on the network. Meditek uses FHIR queries to be able to retrieve those records inbound, but CommonWell can act as a broker here and convert those XCA transactions to FHIR and vice versa. So that's the powerful thing about CommonWell. And what we're going to do now is that we're going to, once we have the document, as you can see, files in right from the CommonWell network, we can use Meditek's One Touch to be able to view medications, allergies, and problems that can be filed in discreetly right from the document itself. So if they hit medications, we can see that we can now reconcile those medications that were captured on previous stays and bring them right into the Meditek patient's chart. And that'll be made available downstream as well when Meditek eventually generates a document. So we're going to order some labs and also a chest x-ray, which is going to confirm the diagnosis of pneumonia, and we're going to document that diagnosis as well onto the patient's chart. And we're going to administer azithromycin on the patient for Oscar, so he can treat him during the patient's stay at the hospital. Once he's stabilized and feeling a little bit better, we're going to discharge Oscar. So when we hit the discharge, we also prescribe him with azithromycin to take home with him for 4 days to treat the pneumonia. And when we discharge Oscar, again, we're going to send a ADT transaction to the neurologist using CommonWell's event notification service. Again, we did it upon admission. Now we do it on discharge, so we'll see that later on down the line. And then we'll hand it over to, at this point, we hand it over to eClinicalWorks so they can see that event notification and the ADT alert and where that ends up on their system.
So Dr. Sam Willis' office has enrolled to receive notifications from Commonwealth ENS network, and through these notifications, Dr. Sam Willis was notified that Oscar had 2 episodes of pneumonia, as you can see over here, and they also observed that their lymphocytes have drastically reduced. They later on was informed that the patient has decided to see another neurologist who is situated in Baton Rouge, and Dr. Samvelis will continue to coordinate with the concerned practice and take care of the patient. I'll hand over to Meditek to take it from here. Thank you.
Hi, I'm Mei Lee, VP of Product at Health Gorilla. We are a health interoperability platform making patient data actionable for everyone everywhere, and we're proud to be a CommonWell connector. Let's continue on with Oscar's healthcare journey in Baton Rouge. Upon discharge from the ED, Oscar establishes care with a neurologist at Praline Specialty Clinic. If you look to the monitor on my left, I've logged in as a neurologist and I enter into Oscar's patient chart. Using Health Gorilla's Patient 360, the neurologist initiates a request for Oscar's past medical records. And for the purposes of this demo, I've created a special FHIR button. As opposed to XCA query document-based exchange, FHIR allows the neurologist to request FHIR resources, which are individual packets of information, such as medications and labs, and allows greater flexibility to only retrieve data of interest. I want to now have us focus to the monitor on my right as we go through the FHIR workflow. This graphic demonstrates the behind-the-scenes FHIR workflow between Health Gorilla as the FHIR client, CommonWell as the FHIR directory, and MEDITECH as the FHIR server, and how Health Gorilla can obtain Oscar's data from MEDITECH's server. We're now going to walk through each of these steps in greater detail. Now, I want to mention that each of these screenshots that you see here aren't just for show. They're from the actual calls, and the red boxes highlight key pieces of information. Using Health Gorilla's patient ID and organization, Health Gorilla sends a FHIR directory call to CommonWell to determine where there are patient matches from existing care locations. And when found, discover the FHIR endpoints to query directly for patient data. Here is the patient match response based on CommonWell's Master Patient Index. And specifically, this is the match for Oscar, and you can see here MEDITECH's patient identifier. Further down in the same match response, Health Gorilla sees the MEDITECH ED organization as a trusted endpoint in the CommonWell network.
So the power, we're going to talk about the Trusted Dynamic Client Registration next. And the power of this is that we're going to use the CommonWell Trust framework as well. And it's going to ensure that we can automatically register and onboard a MEDITECH client or a CommonWell client to any CommonWell server. In this particular case, it's going to be the MEDITECH server. So this means that a healthcare organization doesn't have to have prior affiliations with any organization. They just need to simply be on the CommonWell network, and they can make this the registration process simplified. So in this case, Health Gorilla is going to be the client, and MEDITECH is going to be the FHIR server here. So Health Gorilla is going to perform a query, as we can see here, and it's going to discover the register endpoints and some details about that endpoints. And so Health Gorilla can construct the registration request, and then we'll talk about the request. So next in the request, Health Gorilla is going to build that JSON web token in assertion, along with the signed CommonWell certificate. So we're going to be able to send that to the MEDITECH endpoint, so we know that that's trusted because of that signed certificate. Okay? And then on the response, that checks out. The MEDITECH authorization server is going to find that certificate. It's a trusted source, at which point we're going to issue a client ID, send it on to Health Gorilla, and Health Gorilla now is going to be able to query those FHIR records, such as the medications and labs. And at this point, I'll hand it back to Mei Lee, and she'll show you how that happens.
Thanks. Health Gorilla obtains the access token using the client ID and assertion. With dynamic registration complete, Health Gorilla uses the MEDITECH patient ID supplied by the CommonWell FHIR directory and the access token provided by the MEDITECH FHIR server to retrieve relevant patient data, such as medications and labs, as FHIR resources from the MEDITECH server. We've shown you the FHIR data exchange in great detail because we're excited about the broader adoption and how it will ultimately improve
care for patients like Oscar. I want to direct you back to the monitor on my left, where we now are in Health Gorilla's patients chart, which presents a single aggregated view of Oscar's medical history. After reviewing and discussing with the neurologist in Buffalo, the neurologist at Praline decides to discontinue Tecfidera, which is causing low lymphocytes and repeated infections. The neurologist recommends a follow-up in 6 weeks for labs and medications. I'm going to hand it over to CommonWell to close this out.
Just to quickly revisit what we shared in our demonstration today, Oscar had smooth transitions and care coordination not only across multiple providers and different health IT systems, but across more than 1,000 miles. All of this happens thanks to Commonwealth services like patient ID and linking, our record locator service, data query and retrieve broker, and our members' ability to seamlessly deliver these services to their clients. We showed you things like auto linking to streamline the patient matching process, ADT notifications for care continuity, FHIR document and FHIR discrete resource exchange, trusted dynamic client registration, and all of this built into the solutions. This is all to ensure that Oscar was the priority when it came to coordinating his care. Our network has more than 25,000 provider organizations today and continues to grow each and every day. Thank you so much for watching our demonstration.